All right, so welcome everyone to the Hemophilia Council of California's Advocacy and Policy webinar. My name is Elaine Kintz. I'm the Executive Director of the Hemophilia Council of California and wanted to welcome you to the California Children's Services What You Need to Know webinar that we are hosting this evening. So with that sort of concludes the formal presentation, and I know we're at pretty much at time, but Meredith and I are happy to stick around for a little bit and answer any questions that we might have. So I'm going to go through a couple things that I've seen on here, and some folks have asked about the recording. So do want to let you know we will be posting this on the Hemophilia Council website, which is just www.hemophiliaca.org. It will take us a little bit of time in order to edit the recording and get everything posted, but the recording, the slides, and the links will be posted at a later date. And if you need something more urgently, you can feel free to email me. That is on the screen, and I will put it in the chat so it's easier to copy and paste. And I don't see other questions in the chat. Folks can feel free to unmute or type something in if they have another question. But I did want to quickly ask one question for those that might be interested. So for transition purposes, Meredith, when you know, CCS covers up to age 21. So once a child who's been on CCS turns 21, they will not be eligible for CCS anymore. What should they do as they're maybe in that 20th year and preparing for that transition?
Yeah, that's definitely something good to plan ahead on. And so, you know, be thinking about that. We encourage youth to start thinking about that, you know, even like at 14, and then we remind them every couple years, 16, 18, and then 20 is when it's really important to get that plan in place. So for hemophilia, the GHPP program that I mentioned in the beginning will be a good option for coverage. GHPP is similar to CCS, but it covers fewer conditions. So it doesn't cover all of the same conditions that CCS covers, but it does include hemophilia and sickle cell and cystic fibrosis and a handful of other conditions. So there is like a timeline to getting that in place so that you don't have a lapse in coverage you know, on your 21st birthday. So that's something to plan ahead on. Call your local CCS office and they can help you with that application to GHPP. Yeah, and then also that's a good question to be talking to your HTC about, in terms of, you know, are you going to continue to go to the same HTC, or are you going to switch to an adult, you know, like from a pediatric provider to an adult provider? And so those are good questions to have with them too. And then, you know, making sure that the whatever your new coverage is, if it's GHPP or something else, that that they cover the new provider if you're going to have a new provider.
Yeah, and I'll just add on that for GHPP, any provider that's authorized to provide services to Medi-Cal is an authorized GHPP provider. So as long as they're like sort of registered with Medi-Cal, they can be a provider via GHPP. But I'll do a little plug and jump ahead that in August, we're going to have a webinar very similar to this one, but focused on GHPP. So if either you're currently on GHPP or you think that might be a good option, or you are a student who, you know, a young person who, or a parent of a young person who's in that sort of 18, 19, 20-year-old range, and you're thinking, how are we going to do this? That'd be a great time to hop on and learn more about GHPP so that you can, you know, be prepared to fill out that application and make that transition.
Yeah, great question.
Carlos, I see that there was a question in Spanish. Are you able to hop onto the English channel and tell us what that question is?
Yes, absolutely. It is from Socorro Cerezo, and she says, I have a daughter who is pregnant and is 21 years old. Right now, she only has Medi-Cal, but she has had a lot of problems to see her hematologist. What should I do?
Excellent question. So if she is 21, then she could qualify, and if she's already on Medi-Cal, then she will qualify for GHPP as well if she has a diagnosed bleeding disorder. Or she may be able to get the diagnostic portion covered. So if that's something that you guys are having trouble accessing, if you can email me or email Andrea. Andrea, why don't you put your email in the chat as well? Andrea Palladino is on our staff, and she is bilingual. And so if you need to communicate with us in Spanish, you can send your question to Andrea, and then she and I can work together on answering that back to you in Spanish to kind of help you work through that. Peyton, you had a question about double coverage in CCS. Did you want to unmute and ask your question?
Yes. So originally we applied for CCS when my daughter was diagnosed with VWD a few years ago, and we were denied CCS. And so we applied for Medi-Cal, but it took a while for approval. And so we have other coverage, and that's what we've been using for the HTC. But we did eventually get approved for Medi-Cal, but I've never actually used it. But now we're due for new medication. And so that's why I hopped on this to see where we would stick. So I'm not sure if we would technically qualify for CCS because we're double covered and we're not actually using the Medi-Cal for the HTC stuff. We're using our other insurance. I know it's kind of an odd question.
So it sounds like you would be eligible for CCS. So it's okay to have private insurance and CCS. So if your daughter did qualify for Medi-Cal, then I would contact your county CCS office and ask to reapply. And that way, your private insurance will still be used as the primary coverage, but then the provider will submit any remainders to Medi-Cal, and that way you shouldn't get any out-of-pocket bills. Yep. For anything related to the von Willebrand's treatment.
Yeah, I would definitely, if you're at the HTC specifically, I would talk that through with them. If you're not, we might need to help you sort of specifically navigate that in terms of talking to your CCS office, and then they can maybe help you advise your provider. But like Meredith said, the state programs are generally the payer of last resort, which means they're going to bill your private insurance first. But if your private insurance doesn't cover everything and you have qualified for Medi-Cal and or CCS or GHPP for that matter, then it's going to sort of sweep behind and hopefully pick up the parts that your insurance doesn't cover. And okay. Particularly when it's related to the covered condition. For CCS, then you shouldn't have out of pocket for that.
Thank you.
Yeah. Okay, any other questions? I'm not seeing anything more in the chat. I hope I didn't miss anything because there's been some back and forth questions. There was one regarding blood factor. Peter had asked if that exception applies to beneficiaries in whole health model or whole county models or all CCS beneficiaries. And so yes, blood factor is always carved out of any kind of managed care, whether it's Medi-Cal, CCS, or GHPP. Blood factor, or for that matter, something like Hemlibra, is always paid directly by the state, either via CalRx or in certain more rare instances, it's billed directly through the medical benefit. So, but it's always to the state. And then one other quick thing, we did have 2 community member raffle winners. I don't know if they're still on the line. Congrats to Wayne and Jerome. If you can, make sure you message Andrea, and so you know that we have your information and we can get you that raffle item. So with that, we will wrap up. As I noted here, we have a number of webinars coming up. Next month, we're going to be talking about transition. So we will be talking a little bit more in depth about, moving from CCS to GHPP, if that's the case, and some of the intricacies around that. When, for example, students go away from school and maybe they're outside of their CCS home county in a different county, try to address some of those challenges. In August, we'll be talking about GHPP, and then September, more understanding of health insurance in general. And I do want to briefly thank all of our sponsors that make this webinar series possible. We have Takeda, Sanofi, BioMarin, Novo Nordisk, Pfizer, the Hemophilia Alliance, and CSL Behring, who help support these presentations. So thank you so much, Meredith, for your time. Again, if you guys have follow-up questions or like specific individual situations that you need assistance with, don't hesitate to reach out to us. And Meredith is specifically there in Humboldt County, but sometimes if I get a particular sticky CCS question, even if it's in a different county, I will call her, and she knows a lot of folks in other counties too, so she can help. She helps us navigate those on occasion. Thank you so much for joining us. We'll see you next month. Bye-bye.